50% of the local doctors who are in your network are under pressure to conform to the requirements of care to avoid being kicked out of the network. So that's a hit on quality.
Your organization has achieved a significant dent in vaccine mandates.
We didn't do the science. We didn't do the clinical trials. We didn't do the post safety. But one thing we know it's rare.
Hello, and thank you for joining us. This is Shot Callers, and I am Carrie Bigford, Outreach Director with Texans for Vaccine Choice. And today we have a wonderful guest in the form of Charles Frohman. He wears many hats, honestly. He is the head lobbyist for the National Health Federation, which is the oldest medical liberty and health advocacy organization in the nation. He also moonlights as a professor and a libertarian yogi. And today he's here to talk to us about leaving the system of health insurance. So many people feel trapped right now in the allopathic model of traditional healthcare insurance, and they're financially prohibited from joining a direct care model where they can truly direct their own care. And Charles, seeing a great need, met that need by helping others to design ways to escape that system and receive care without going bankrupt. So without further ado, I am very, very excited to welcome Charles Frohman to the show today. Thank you so much for joining us, Charles.
Thanks, Carrie. Good to be with you again. And, to say a few words about your intro. First, I want to say, I think with the awakening that really expedited because of COVID, a lot of folks would like to make money doing good, and that kind of stems from another Texan, John Mackey at Whole Foods, whose nonprofit Flow, which turned into conscious capitalism, I helped develop with Michael Strong back in 2005. And I am working and getting paid to do good, I think, both from upgrading families and small business owners from Obamacare into what's called medical cost sharing. And I also get paid to lobby for the world's oldest health freedom organization. And while it may sound commercial and crass to get commissions, helping folks get a better way to pay for their catastrophic health expenses, it's also political, which makes it really mesh with my personality because how we're so much cheaper than insurance and how much better it's so much better is because we enable what's called the cash market. And the cash market is a critical phrase in healthcare politics because without real pricing, we're never going to reform healthcare. We all remember from economics class the supply and demand curves. Well, that depends on a price, and a price is the signal which tells you the value of something. But we don't really have real prices, and so what we do is we give you a shopping assistant, sort of your own Nordstrom shopper, to help you find quality priced prescriptions if your doctor wants you to take a maintenance med, or a cash imaging facility or testing facility if your specialist wants you to get some testing, or the specialists themselves if you need to have a surgery or procedure of some kind. Our concierge team has a lot of tools, such as Healthcare Blue Book, Prater. There's all kinds of tools out there of companies that disgorge, grab bundle pricing from the hospitals, including the surgeon, the anesthesiologist, the facility fee, and they'll compare them. And they'll also look at outcomes, including readmissions. So that hospital that your doctor wants you to go to, their readmissions rate's pretty poor. These specialists over here have really good readmissions rates and have better feedback from patients and are better priced. And they work at what are called ambulatory surgical centers. These are fantastic surgeons that work for themselves in an independent facility, and they have better outcomes. So do you want to try that? And that's how we get to a real market in healthcare. That's what our sharing community uses. And so it's become quite popular, but still a lot of folks don't know about it. It is like leaving a bank for a credit union, so it shouldn't be that big a challenge for folks. And indeed, most of the millions who have migrated from Obamacare insurance to medical cost sharing don't go back, because to go back to insurance would mean that you don't mind the networks that exclude up to half of a given area's providers. And by the way, the providers who remain in the network, that other half that you can see if you have an insurance plan, they have to really avoid going outside the scope of practice for fear of being booted from that network. So they're not going to really think outside the box for what's needed in the current epidemic of chronic disease. These lifelong painful disabilities that people suffer that really are hard to treat with a pharma pill. So the quality goes down with networks. And we heard from that tragic murder of that CEO, that insurance company boss, that up to a quarter of claims were being denied, sometimes arbitrarily, sometimes using artificial intelligence. And the news kept getting worse. We heard that some Obamacare plans would make you wait on a claim during open enrollment, that period in the fall when you annually can go get a new insurance plan, until January, when hopefully you will have migrated to another insurance plan, so your old insurance plan doesn't have to pay your expensive cancer. So, and then the premiums increase every year, and they're going to increase a lot now because a lot of people are losing what are called temporary subsidies. They still have their old long-term subsidies, but if you wrongly estimate your income for the coming year, and by the time you file your taxes, you earned more than you predicted, the government will claw back your subsidy. So there are so many problems with the way Obamacare distorted the insurance market that unless you're getting a really fat subsidy that makes your premium down to less than $50 a month, I tell folks, make the jump. The average price will be $300 for an individual, $500 to $600 for a family. That still seems like a lot, but as more folks join sharing communities, that price will go down too with time, with competition. But you can also get sharing combined with a medical savings account or a health savings account, as they're called now. And that basically is a tax shelter into which individuals can contribute annually over $4,000 and families over $8,000. And you multiply that by the number of years until you retire, easily you can see building $100,000, which is a nice nest egg, either for the long-term care expenses that you're going to have when you turn 80 and 90, or if you're healthy into your old age, you could use that money for a nice vacation, a nice retirement lifestyle. So I have pretty happy customers, and I urge folks to help join the cash revolution. And don't think Obamacare is your only way to pay for catastrophic expenses like cancer or heart disease.
What about major life events like a pregnancy or a birth? Are those covered by those cost sharings? And do they cover things like home births or birth center births instead of just a hospital birth? I know traditional insurance, only allows you to birth in a hospital in network and doesn't, you have to pay out of pocket if you want to do a home birth or work in a birth center. What about things like that?
They're really good with pregnancies. The only catch is make sure you join the medical cost sharing community before you conceive, because there is a waiting period of a few months. Because when sharing first got popular a decade ago, a lot of new mothers joined because they learned how nice the benefits are. And so they will actually reduce your out-of-pocket deductible. We call it an initial unshareable amount if you do use a birthing center. Especially natural moms caught on quick that there was nothing better than sharing when it came to birthing expenses.
Yeah. I had 2 home births and a birth center birth. And I left the traditional healthcare system years and years ago. I was self-employed before I joined TFEC, and I did cost sharing programs for a very long time. And it was the only way to have that type of care really be affordable and accessible. And I love seeing the proliferation of these alternatives, and especially the HSAs and the FSAs, because you can use that for supplementation, for, chiropractic, for acupuncture, for things that traditional insurance would never even dream of covering because it threatens their allopathic domination model. They're accessible and affordable through these cost share programs. Like how do people join? Like, is there a website? Do they contact you? Like, what does that process look like? And what is that off ramp of, waiting period before you can start filing claims? Like, what are those details?
This is my Substack on
Mhm.
the media's attack on sharing, because as we gain millions of members, the mainstream media, reliant as it is on advertising from incumbent
Mhm.
cartel members like insurance companies, will do their
Mhm.
part to lie about us to keep people from leaving the plantation. And
Yep.
so every Obamacare open enrollment story warns people against sharing. Um, they'll say that um, sharing offers significantly less coverage um, than Obamacare. Um, and I gave a bad word here in response, my rebuttal, because
But an accurate word.
as I just said, um, and I'll put this, I'll get this link to you for the notes, so folks can
That would be great.
look at the evidence itself. I linked right here. Here's
Mhm.
the evidence. Obamacare excludes half of the doctors in your area. How is sharing less coverage than that?
Yeah.
um, and then see what else does the mainstream media lie about sharing? They say sharing doesn't offer coverage guarantees. That is true, but it's misleading when you exclude from the statement that so does Obamacare. Um,
Yeah.
their pre-authorization approvals include fine print declining any guarantee of payment. And there's the link. Folks
Absolutely.
can read it themselves. Um,
Yep.
so, and then your average deductible for Obamacare is 5 grand. You can have a $5,000 IUA with us too. I recommend them actually because the more you can build a health savings account, the more you're self-insuring and being the first payment,
Mhm.
and your discretion is yours. When you rely on a third
Mhm.
party, whether sharing, insurance, or government, someone else decides, and you never want that to be something that suffer from in the world. So to answer your question, um, so at this Substack is my link, and what I
Mhm.
tell people is scroll down to the video first. It's about 9 minutes long, so you understand it. You should go into any new opportunity with your eyes open. So this clearly explains what I just said. Why sharing is great. Um, there's a pre-existing condition phase-in for any symptoms you've had over the past 2 years. So anyone who had recent cancer or heart disease, I will discourage you from joining. And that's what Obamacare is becoming. It's becoming a risk pool
Mhm.
for the sick, as risk pools existed before Obamacare in at least 35 states. So um, smart people never can outplan the market, neither can Obamacare. Obamacare
Right.
eventually will just replace what was there already. Um,
Mhm.
a safety net for the uninsurable.
Right.
Now, how does it work? Let's see here. What I what I share next with people is that um, let me go up here. So here are our plans. You can get it. You can get just sharing or sharing with a health savings account. We have two options. And if you go to one option, for example, what I would do is I would just show you this page, kind of go over the details. The sharing guidelines are right here. If you click those, um, we partner with Zion Health on one, and then we add to it our own concierge service. telemedicine so that we can help you with all of the costs that occur before the sharing kicks in, because sharing is major medical, and most of your bills are going to be below $3,000. So you're still going to need help shopping for tests and specialist visits, procedures.
Mm-hmm.
So let's see if we can't. Okay. So what I do is I tell folks, look at the table of contents in the sharing guidelines, and then just check out that which interests you specifically. And for you, it was maternity sharing requests on the right page, and page 23. I would just tell you to go read that and get back to me. The waiting period, what's eligible, what's ineligible, the role of midwives, home births, separate sharing requests, premature birth, IVF, miscarriage, diabetes, and then expenses below that in black highlight and bold, what's eligible for sharing, and then two phrases below that, what's ineligible for sharing, mainly illegal acts, being drunk driving incidents or illegal drugs.
Which would also be banned from coverage for traditional insurance also.
True. So
yeah,
it's pretty comprehensive. So I tell folks to read that if there's anything in particular that interests them. And then up top on the right column is pre-membership medical conditions, pre-existing. Make sure you read that part so that if you have any checkup that you have from a previous cancer, you know that if you have something new, that we're going to request your medical records, and if we could tie your new request to a pre-existing condition, there's going to be a phased-in sharing for that. Nothing in the first year, $25,000 in the second year, $50,000 in year 3, and then you're good to go by year 4. So that's how we keep our community. That's how we keep our community's prices affordable, by making folks wait on anything that pre-existed, which is logical because you can't get insurance for your home after a fire. You really can't. Insurance isn't designed to help people after they're already sick. That's what Obamacare is there for, as a backup for the sick. And then, some folks will get Obamacare and us, so that during the phase in of pre-existing conditions, they'll have Obamacare for a couple of years in case something flares up. And then once a couple of years passes, they're good to go, because now they have $50,000 at least available for their pre-existing condition. And by year 4, there's no limit with one of our plans. There's a annual limit with this plan, but with my other sharing, if that concerns you, we can get the other sharing plan, which has no annual limit on the pre-X. So, that's why you want to talk to an expert like myself, as we know the details of these plans. And then back to the sharing page. On the left column here are monthly contributions. You pay something, and there's responsibilities like a deductible. You pay from as low as $500 per incident up to $5,000. Depends on your budget, what you can handle. And then here's how you submit claims on the right. So it's pretty simple. And then down here is an example. You break your arm. There's the image of Sarah. She broke her arm, and there in that box.
I think the screen isn't showing what you're looking at, because the share screen hasn't moved. Are you showing it moved on your screen? Oh, there it is. Now it's moved.
Okay, I got a prompt up top.
I think it needed to refresh.
So
I can see that now.
Okay, so Sarah broke her arm, and on the left there, ER visit with X-ray $2,500, surgery $20,000, follow-up visits, PT total cost $24,400. If you had a plan with an IUA of $1,250, that's all you'd pay. And this could become useful for, especially for cancer, because cancer can come back or last longer than a year. That's all you would pay for the life of the disease, $1,250. And if your cancer healed but came back before 12 months passes, that's considered the same cancer, so you would pay nothing.
Wow.
Yeah.
Since Since cost sharing programs really benefit when the population pool of being cost shared is healthier, do these plans offer any type of incentivization towards healthy living choices or any discounts
No,
or, no, nothing like
no,
that?
no. It's with experience, the prices will stay steady. We had a price increase with this plan this year, um, just because there's been an overall rise in cancer rates, um,
Hmm.
utilization about $25 a month. But the real incentive is the health savings account. As you fund that thing, if you don't need to use it for out of pocket costs, you could keep the money and grow it and invest it. And so whatever interest the bank pays into an HSA is tax free, and that rolls over.
Hmm.
And then you could
I
actually
see.
invest the balance or a portion of it. So less tax free and pre tax investing. So that's your
Yeah.
incentive from being healthy and avoiding the doctor is growing your HSA.
Right.
I will say though that in terms of natural health care and healthy living, this plan that we're looking at is very open minded on going to complementary healers for the recovery of the cancers and heart disease. So
That's awesome because traditional insurance, it's like chemo, radiation, surgery, and those are your options.
right, not so with this option, and our other sharing vendor also has a way to get pre-approval for natural therapies in the recovery of the expensive sicknesses and accidents. So natural fans especially will want to consider this. But
Mhm.
this way right here, I was just going to show because if you had the scratchy throat or headache, fever in the middle of the night, this is free. It sometimes it's free with other insurance companies or sharing companies. Sometimes
Mhm.
they charge you. This is free, and not only the urgent
Yeah.
care, but also the chronic care on the left. So if you have some ongoing expenses, you can make
Mhm.
it free by using our online doctors for primary care. And mental health, a lot of folks want more mental health care. We'll give you a dozen in-person visits or online visits, but we don't cover the expensive mental expenses. So that's another limit of sharing. It's just not something the community wants to pay for um, beyond the counseling that's online or in person. That's tell folks if you want comprehensive mental health coverage, Obamacare is going to be your friend for that. But if you're okay with the online dozen free mental health counseling visits, then this is free. So just be aware of that.
Yeah, I mean, I was a mental health provider for many years, as you know, and you can actually create a lot of positive change in your life, even with 12 visits with a skilled counselor or a guide to help you do the work. Um, I think 12 visits per year for the average person would be perfectly fine
Yeah,
to help you get through a difficult circumstance and get back on your feet.
yeah. But it's just
Yeah.
something for folks to know. The limits of our
Mhm.
sharing, including what we do share, so they can make a prudent choice for themselves and their businesses. And then we added pet care triage on the right there. Um,
I think that's awesome that you have pet care. That's definitely something that traditional insurance doesn't cover. I've even seen like insurance companies getting into the veterinary game and they've got like pet insurance plans now that you can pay into for these catastrophic veterinary bills, but they're almost expensive as the human plans. It's pretty amazing.
yeah, I did have a money doubling account that also had a pet version that unfortunately was closed down by the FBI that I obviously
What?
can't sell anymore. Um, a lot of people on the edge, entrepreneurs, mavericks, do go down for the count. Sometimes with justification, sometimes for politics. I'm not sure which is the
Mhm.
case for this count that I used to sell. The jury is out,
Mhm.
but I know they were very popular for years, including their pet plan, because pet insurance as well as dental insurance are ripoffs. Um,
Yeah.
but they are needed, and the markets need to mature, much like long-term care insurance. They
Mhm.
didn't price those things correctly, and the market collapsed. long-term care insurance is returning now, but a lot of folks are not prepared for long-term care costs.
Right.
But
Which is
what I tell,
exorbitant.
I'm sorry.
The long-term care cost is exorbitant.
Yeah, that's why I say
Yeah.
at least build your health savings account so you have $100,000.
Mhm.
And then there are these life policies that have long-term care policies attached to them, so they're expensive and they have their critics, but people should learn about them too. Just so you can think about what are you going to do. You need to think about it because it's a pretty fragmented market without a lot of good options, and a lot of us are going to face
Mhm.
severe costs when we're old.
Mhm.
But back to major medical, the final thing I tell folks is up top, fill out the questionnaire. Your answers will be emailed to me, and I'll schedule a discussion to hear your needs. And if you're a business, there's the group link. You would just fill out a census. How many workers you have, individual, family, and then we could get you set up for a group plan for small businesses, less than 50 workers. If you have 50 or more workers, there are some additional Obamacare and what are called ERISA compliance burdens. And we use something Trump expanded called an ICRA, Individual Coverage Health Reimbursement Arrangement, to cover the big businesses. So sharing is now available in groups. And,
That's awesome.
yeah, and then for the sick people, they would get Obamacare and they would either get a subsidy, making it affordable for them, or the boss can bonus everyone and make you whole that way indirectly after the fact. And for the sharing, they can deduct from payroll um, what they're paying for you, or have you pay the employee, and then just give you a bonus per month to make you whole or partially whole. So there's various ways to make it affordable for the employer. But again, for the employee or for families, when you're a sharing member, you're accessing cash prices.
Right.
The only thing you're going to tell a doctor or hospital is, "I'm a cash patient. Do you have a discount?" And you don't have to tell them you're a member of a sharing community. You just tell
Yeah.
them you're a cash patient. They're going to give you a significant discount. You'll use your health savings account for the first $1,000 or so, and then you'll submit the itemized medical bill to the community to get the money to pay with one of our vendors, or there's an arrangement where if you allow us to use Healthcare Blue Book to find you a better quality doctor or surgeon, uh, we'll pay directly the provider, which makes it convenient because sometimes hospitalizations can come with a lot of different bills. So if you don't want to be the person handling the bills, there is an arrangement we can offer that will do all the bill paying for you. So that's how it works.
It sounds awesome, and I know that, like, as a patient, being a direct cash pay patient is pretty much the only way to get financial clarity from traditional healthcare systems and institutions. Because if you're a traditional insurance patient, they can't tell you what the final amount billed to your insurance is going to be because they're going to bill for the entire amount they possibly can, and they don't disclose that to you ahead of time. So they can't ever tell you like what your co-insurance is going to be because they don't know. They're going to charge your insurance for everything under the sun they can possibly get away with, and you're stuck with whatever your insurance company denies, and you're not a part of that process. They don't owe you any transparency, whereas as a cash patient, there's federal laws and state laws, at least in Texas, that require them to be transparent with you about the cost of treatment up front. And they're held to those numbers and they're held accountable in a way that they aren't held to those numbers for an insurance patient. So that's like another bonus that I discovered just from the consumer side, that people had to be more honest with me about what they were going to charge for these services or these interventions. Whereas when I had traditional insurance, they were like, "Oh, well, we can't tell you. We're gonna have to bill the insurance and find out along the way." And it's like, nonsense. You know what you're going to bill. Why can't you tell me what you're going to bill?
Yeah, the co-insurance trap. People don't think about that. They think about their premium and their deductible.
Yeah.
Um, they learned through Obamacare the hard way that their average deductible is $5,000, sometimes more. They learned with sticker shock that their premiums were going up to an amount that was like their mortgage, $1,000
Yeah.
a month. But no one thinks about coinsurance when you're hospitalized. 20% of that bill. Think of a $20,000 bill or more, and you're on the hook for that. And uh, real narrow network, affordable Obamacare plans on the exchange. Um, Sometimes the anesthesiologist or doctor in the ER or in the operating room is not in network, and you'll get a surprise
Mhm.
bill that's going to bankrupt you. And bankruptcy is caused a lot by these non-network doctors, um,
Yep.
and it's a big cause of bankruptcies. So these people are insured, but they're going bankrupt. So, like I showed you with the example with Sarah who broke her arm, your initial insurable amount, your IUA, our phrase for the deductible is $1,250. It can be as low as 500 or as high as 5,000. That's your out of pocket limit. That's all you're going to pay. And
Which is not even walking into an ER.
yeah,
Like, yeah.
and then for a lot of your procedures and tests and out of pocket expenses, you've got the health savings account that you could, build and use that. Or the telemedicine is free. If you could triage it online, just get some advice from a counselor or a doctor. They can help you save money, save out of pocket. So I'm pretty psyched to be selling these plans. We have new sharing vendors coming into play. We have a third one that we're testing in Brazil. And there are other sharing communities out there that don't work with brokers that you can access directly. Um,
Mhm.
so it's exciting. It's like leaving a bank for a credit union. People don't mind leaving a bank for a credit union. It looks the same in a credit union. They treat you a little nicer. Sometimes the interest that they pay on your account is a little better. It's nice to have the option. That same dynamic now is available with health payment. You could go to Obamacare, especially if you have to, if you're currently sick and you can't risk the pre-existing phase-in of sharing. But for
Mhm.
anyone for which pre-existing is not an issue, um, there's no reason not to make the move. Now, I tell folks who are on now group plans now at their work, I say, look, what your boss provides you is free money. It's income. It's not taxed. Keep it. You're going to be paying 300 to 500 a month with me, based on whether you're an individual or a family. It's better than what you have, but you're going to be paying something. So I'm honest with people. Is if it's worth it, I'll enroll you, but you're getting free benefits at your work, so keep it. Um, Talk to your HR about upgrading to me so that they'll pay for it and you'll get sharing, which gives you access to all doctors because all doctors have a cash price.
Yeah.
Whereas your group plan now has a network, which excludes half of your area's doctors.
And that in network, those guidelines really direct the care that's even suggested to you or the care path that even exists for you in the realm of possibility. Because when you're and part of that insurance network, those non-medical insurance bureaucrats are the ones who direct what services you're allowed to even pursue or consider as a patient. And again, like for me, the big defining line as a consumer is the utter lack of financial transparency regarding the traditional health insurance model. Nobody can tell me what they're going to charge my insurance and therefore what my co-insurance is going to be. It's some big mystery. They always play some upcoding billing game that's just despicable and borderline fraudulent, if not outright fraudulent. And a direct pay model where you would present yourself as a cash patient to providers, in my experience, at least my limited individual experience, I get so much more transparent care and I get better care and I'm a more vested partner in that care and I'm able to shop around and get the services that really fit my needs best. And I know what I'm getting into. Whereas with the traditional insurance model, it's always a mystery. Like you just get these bills that you're obligated for, and you have to play hot potato arguing between the insurance company and the provider trying to get claims sorted out, see where the billing error happened. And in any case, they're just like, well, you're just stuck with these bills and, good luck to you. It's a very different experience as a consumer.
Yeah, that's a mess. I mean, you're making good points. The 50% of the local doctors who are in your network are under pressure to conform to the requirements of
Absolutely.
care to avoid being kicked out of the network. So
Yep.
that's a hit on quality. And,
Yep.
when a doctor receives a cash price, he or she knows that he or she, the doctor, doesn't have to worry about coding or reimbursement fights. They're being paid now in cash. And
Yep.
you're right, you could shop that price before you get the care if it's discretionary. Our concierge
Mhm.
shoppers have fantastic tools that'll help you in that process. Healthcare Blue Book rates doctors and hospitals on readmissions, and you may not have thought about what specialist might be best for you that's in your area that has a much better outcomes rate and popularity and price than the one you're being steered to within the hospital system. Sometimes a vertical system where the specialist is owned by the hospital and has that same dynamic of looking for coding and profit opportunities versus what's in your best interest. So yeah, it's
Yeah.
it's a matter of injury and safety and living to really support that cash model to make these doctors and hospitals focus on you, the patient, and stop this.
As they should have been this whole time, but a lot of them have lost their way and they're committed to that insurance model.
Yeah, they don't know any other
Yeah.
way. Um,
Yep.
but especially if you get cancer or heart disease, you're going to want to have access to the centers of excellence or places that you're only now hearing about, like Invita in Arizona, which has a wonderful cancer success rate, much higher than your typical oncologist.
Mhm.
Or maybe you want to try one of the quality cancer alternative providers in Mexico or overseas. These sharing plans will share at least partially in overseas care, whether it's a full on treatment plan with one of our sharing vendors, or at least triage with one of the others. So if medical tourism overseas care is important to you, we have two different options of different values, and that's why you want to kind of go through a brokerage like ours because we specialize in these sharing vendors, so we can know what their differences are, and if one of them falls down on the job, we could create a bridge to another sharing vendor to keep you whole, and that has happened. So
Right.
this is an exciting place to be, and it complements my Maha Health Freedom lobbying work. That you're a part of.
Absolutely.
In fact,
Yeah.
it is part of our lobbying because I showed you the articles earlier where mainstream media is criticizing sharing, and they're not using truthful or fully contextual information to tell you the whole story. Uh, Sharing is under attack in the states and federally, and so we do need to protect it. Because the biggest problem with healthcare is the monopoly status that Obamacare has. And that's not just
Absolutely.
by law, it's by effect. People just don't know about the sharing alternative. So it's political. We need to support sharing so folks will know about it, get into it, take advantage of the cash revolution, without which you can't reform that supply and demand curve. And also
Right.
to be ready to help us grassroots wise if we need help to defeat, a bad bill like in Colorado, or New Mexico pretty soon, or federally. There's the federal bill doesn't have much traction, but you never know what can happen especially if the wrong party gets in control of Congress. And then, we mentioned these doctors who are reliant on reimbursement. There are some political efforts that we could support that would uh, spread out the dynamic in healthcare, like safe harbors, scope of practice expansions, or my favorite, competitive certification, which would help
Mhm.
integrate healing and lessen the top-down standards making threat, like licensing boards, which keeps healthcare so limited. So there's a lot of political things we should discuss in the context of sharing, so folks realize this is a big fight. It's gonna be a long fight. We need their help.
Well, and also with another benefit of the sharing option by making direct pay care, a cash pay affordable and accessible to the average person, it encourages those doctors who maybe feel trapped in that insurance model who want to leave, but they can't find a way to have that be financially feasible because as a provider going from being an insurance practice to being a direct cash pay practice, those are two different businesses that operate very differently and there isn't a lot of crossover. So to help those providers who want to practice more ethically, who want to, be the doctors that they dreamed of being when they went to medical school before they realized they were just going to be following what the insurance adjuster told them to do without their own critical thinking aspect, it gives them an option too to have the funding to be able to reach the patients that they want to reach and practice medicine they want to practice medicine and show up for you the way that a lot of them really want to but feel handcuffed by this insurance model. Like that's another thing to consider.
For sure. And, you know, some primary care doctors have started charging monthly subscription fees for unlimited access. And it's called DPC, direct primary care, and it complements nicely the sharing. And now with changes under Trump, the HSA as well. So you can have a health savings account and a monthly DPC arrangement with a doctor, as well as a sharing for major medical. And now some specialists are going direct pay. It's slow, but it's growing. It's important. Um, UberDoc, Dr. Muto's app gets you a cash consulting appointment with a lot of specialists in different fields. That's a good new venture that should be supported. Dr. Arshad's Wow app is meant to make all appointments based on cash, and he starts with a network, but a lot of these networks have doctors with cash price offerings, even though they do chase reimbursement with insurance companies. So there will be some hybrid dynamic in the transition that to the cash model,
Hmm.
and that's okay. Whatever it takes to get there. Doctors have
Yeah.
mortgages and expenses and habits. Um,
And student debt. I mean, it's very expensive to become a doctor.
yeah, and they have
Yeah.
programming from medical school on the allopathic model. And what happens nicely, especially with the DPC doctors, is even if they were allopath, when they get unlimited time with patients, they start to think outside the box and, in
Yep.
effect, become integrated, even though that wasn't their intent. And that's been a real
Yep.
nice result of subscription payment models. Monthly payments aren't for everyone. I'm not sure what a healthy person gets out of it, but a big family with a lot of expenses or someone with chronic disease who needs a lot of
Hmm.
visits, the cost benefit analysis makes sense to do a monthly payment of
Hmm.
$100 and get unlimited access to a doctor for a lot of chronic ongoing care needs.
Hmm.
And that's half the
Right.
population. So I think it's a good model
Yeah.
for, especially for certain cohorts. Otherwise, I think, Obamacare has helped a lot of doctors and patients become cash patients because the deductibles were so big, five, six, seven, eight, nine, 10 grand. Um,
Yeah.
so accidentally, Obamacare has helped the cash market, which will help us.
Yeah. Well, I love what you're doing. Make sure to send me those links so that we can put it in the final episode so that people can discover more about how this is a good fit for them, especially if you have to provide your own health insurance if it's not provided by your employer, or if you don't have enough coverage by your employer and need something additional. These cost sharing plans are such a wonderful alternative. And again, they increase your own liberty, your own ability to direct the type of care that you receive and the type of providers that you choose to work with. They're much more flexible and amenable to a wide variety of care paths. So, anything else you want to leave our audience with before we head out for the day, Charles?
Also, ask your HR or CFO or boss, would they consider upgrading from a fully insured or self-funded group plan to sharing, either by way of a list bill, which is what we call a plan for small businesses with 49 workers or below, or an ICRA for 50 or above, so you get that compliance required for larger companies. um, you can influence your own company's health plan, and I can give you guys sharing for the majority of workers, and then for those that do need the assurance of Obamacare, if they've been sick recently, they could get that as well or instead of. With an HSA for the small businesses, with what's called a health reimbursement arrangement for the large businesses. So whether family or business, we can help you.
Awesome. Well, thank you so much for your time. This again has been Charles Frohman talking about pathways to leave the traditional insurance model and join a cost share program. I encourage all of our listeners to read up more about this on ways they can yet again demonstrate their liberty and walk away from the systems that just aren't serving them. I am Carrie Bigford. This has been another engaging episode of Shot Callers. Thank you so much for tuning in, and I will see you next time. Thank you.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.